I would like to start off by reiterating that, based on current evidence, the risk to the general public as a result of this incident remains low. I understand that people in Amesbury and Salisbury and those who've recently visited the area will be concerned about this incident. I would, however, like to reassure you that it is safe to continue with your daily business. Obviously, incidents like this one are very rare. We would like to reassure you that when any health protection incident occurs, we put in place well-established response plans and follow clear processes to ensure we keep the community safe. We evaluate the information that we have and assess the risk to the public constantly based on what we know. It is by using this information that we can confidently advise that the risk to the public in Salisbury and Amesbury remains low. As a highly precautionary measure, however, we are advising that anyone who may have been in any of the areas that are now cordoned off from 10 p.m. on last Friday evening, could take a number of steps. So wash the clothing that they were wearing in an ordinary washing machine using regular detergent at the temperature recommended for those items of clothing. This will not damage the washing machine. Wipe any personal items such as phones and laptops, other electronic items, with cleansing or baby wipes, and dispose of those wipes in the bin, and that's just ordinary domestic waste disposal. If your items are dry clean only, you should keep them double bagged and securely fastened, and further details will follow. You should thoroughly wash your hands with soap and water after cleaning any items. You do not need to seek advice from a health professional unless you are experiencing symptoms. Those people from the area that feel they are experiencing symptoms should follow the normal routes and ring NHS 111. And as the Chief Medical Officer said yesterday, the public should always be careful of picking up dangerous or unknown objects. As has already been mentioned, areas of Salisbury that have already been cleaned as part of the previous incident and which are now back in use, like the maltings, are safe. And I absolutely understand that the events of the past few days and the appearance of further cordons in Salisbury and Amesbury will be a cause for concern. I would like to reassure you that we are working together alongside national and local partners to ensure that the public remains safe and we keep our advice under review and up to date. I'd like to pass on now to my colleague from the hospital.
Charles Sparks, and I'm the Chief Executive of Salisbury District Hospital. As you have heard, we received the 2 patients on Saturday and have been treating them at the hospital ever since. Both of these patients remain in critical condition. Having been exposed to a nerve agent, they are clearly acutely unwell. We will continue to keep you updated on the condition of all these individuals while respecting the privacy to which they and all our patients are entitled. We have seen other members of the public who have come to the hospital with concerns about their health following this incident. We have carried out appropriate tests and none of these individuals have needed treatment. Given the events in March, we at Salisbury District Hospital have developed a wealth of knowledge and experience in treating those exposed to nerve agents. This has meant that we can give these patients the expert care that they need whilst ensuring the safety of our staff, our other patients and visitors to the hospital. I want to reiterate that the hospital remains completely open and operating as normal. If you have an appointment, you should continue to come to the hospital unless you are otherwise informed. Today marks the 70th birthday of the NHS, and as we mark this historic event, we pay tribute to the millions of staff who've worked tirelessly providing amazing care to people across this country every single day since 1948. And I want to pay a special tribute to the staff at Salisbury District Hospital. Yet again, they found themselves treating patients in the most extraordinary of circumstances. Despite these challenges, they've given these patients the same level of outstanding care we strive to give all our patients. This is as true for clinical staff as for those working hard behind the scenes. On our 70th birthday, the treatment of these patients at Salisbury District Hospital is a shining example of the world-leading care provided by our NHS. This hospital has been a vital part of the community for many years, and I, like my colleagues, want to thank the public for their support that they've shown us during this time. Thank you.
As our public health partners have stated, the risk of the public is low, and as we've heard, they will keep this assessment under constant review as further information becomes available. Our role right now is to provide support to our partners as needed, and to be the link between central government and the local communities affected in both Salisbury and Amesbury. There has been, and will continue to be, an impact on businesses and footfall in Amesbury Town Centre and in Salisbury City Centre. We will continue to provide support to those affected, as we have done since the first incident in March. I would urge any business who are concerned about the impact of this recent incident to contact the Swindon and Wiltshire Growth Hub via the website of that name or call 01225 402 096, and they will receive advice and support. We're also supporting residents affected by this latest incident, including those who need to be rehoused temporarily. This is a precautionary measure. Wiltshire Council is meeting with residents to offer help and support, and we will continue to do this and all we can to assist the community and local residents during this extraordinary time. If any residents have concerns, they should call the public information lines that Keir has mentioned, and I'll repeat those numbers. That's 0800 0920 410 or 0207 158 0124. The lines are currently open from 8 AM to 8 PM, but we're looking to extend these in the near future. The recovery programme following the first incident is continuing, and 4 sites have been signed off as clean and safe for use. This is being done by the Government's Decontamination Science Advisory Group. The remaining sites are currently being cleaned by specialist teams, overseen by DEFRA, with the exception of the Skripal's residence, which remains under police investigation. Our strong working assumption is the couple came into contact with the nerve agent in a different location to the sites which were part of the original investigation. All the sites have been decontaminated following the previous incident are safe. We are holding a meeting at the Salisbury Area Board tonight at 7 o'clock in City Hall in Salisbury. A panel of the partners involved in this recent incident will update the local community, and answers will be available to any questions from residents and businesses. Thank you, and I'll hand back to Keir.
Okay, ladies and gentlemen, there's an opportunity for some